Hi, Joe Valenzuela with Vista Mutual Insurance Services. Let's talk about Medicare. What is Medicare? Well, Medicare is a federal health insurance program that's designed for people that are 65 and older, or for certain younger people with disabilities. Also for people with end-stage renal disease or permanent kidney failure that requires dialysis. Medicare is administered by the Centers for Medicare and Medicaid Services, otherwise known as CMS. Let's talk about Medicare Part A. Medicare Part A, your hospital insurance, covers inpatient care inside of hospitals. That means you have to be staying the night in the hospital. It also covers skilled nursing facility care. So if you're inside the hospital and you're getting discharged, but you're a little bit too sick to come home, your doctor may send you to a skilled nursing facility, and Part A covers that. Also, it covers hospice care and some home health care. Now that you know what it covers, let's talk about what it costs you. Well, most people get Part A premium free, as long as you or your spouse have worked and paid FICA taxes for at least 10 years inside the United States. If you've paid FICA taxes for less than 10 years, you are definitely going to have a premium to get Part A, and it varies depending on how much you've worked. There are deductibles and co-insurances for some services. The deductible in 2021 is $1,484. What does that mean to you? That means if you just have Medicare Part A and you go into the hospital, they're going to ask you for $1,484. Now that's good for day 1 through day 60. After day 60, you're going to have a per day coinsurance, and after day 90, you're going to have a higher per day coinsurance. So you see why a lot of people choose to get supplement plans or Medicare Advantage plans to shore up things like this when they happen. Let's talk about Medicare Part B, your medical insurance. It covers services from doctors and other healthcare providers, like your primary care, or if they refer you to a specialist. It also covers outpatient care. So we talked about inpatient care when you're staying in the hospital with Part A, but Part B covers outpatient care. A very common outpatient procedure is a cataract surgery. It's where you're going into the facility, but you come back the same day. It could be in a hospital setting or an ambulatory surgical center. Part B also covers some home health care, and it covers durable medical equipment, oxygen, CPAP masks, wheelchairs, things of that nature. And some preventive services, so your flu shot, your annual wellness exam, your colonoscopy, your mammograms, all covered by Part B. So Medicare Part A and Part B together are what's known as Original Medicare. So now that you know what Part B covers, what are you going to pay for it? Well, there is a monthly premium that can vary depending on your income level. So unlike Part A, everybody pays a premium for Part B. Most people. There are some instances where you can qualify for assistance and get it covered, but most people will pay in 2021 $148.50. That is the baseline. But you also may have to pay an income-related monthly adjustment amount. If you make over a certain threshold, they're going to charge you more for your Medicare Part B. There is also a deductible. And in 2021, that deductible amount is $203. It is an annual deductible, so it's yearly. Once you've met it, it's done. Let's give you an example. If it's January 1st and you just have Medicare Part A and Part B, and you go in to see your doctor and he charges $203, you're going to pay the full $203. After that deductible is met, most services are covered at 20% coinsurance. So that same service, after the deductible is met, the next month you go see your doctor again, and for math purposes, let's just say he charges $200, you would pay 20% of the $200 if you had no other insurance. So that would be $40 out of your pocket. Now this can get up to really high numbers when we're talking about things like cancer treatment and paying 20% of the cost for those. So this is again why most people get Medicare supplements or Medicare Advantage plans, so they pay a lot less when things like that happen. You also may be subject to a late enrollment penalty if you do not elect it when you're first eligible. The penalty for Part B is an additional 10% of the premium for each 12 full months that you were eligible to get it and you went without coverage, and you didn't have any other coverage in place as well. So sometimes we see this where somebody will say, you know what, Part A doesn't cost me anything, and I'm very healthy, so I'm just not going to pick Part B up. You can choose to do that if you'd like, but you're going to face that penalty, and there's only certain times where you can enroll into this type of insurance. So it behooves you to do it as quickly as possible. That is going to do it for Medicare Part A and Part B. I hope you join me next time on my never-ending quest to make Medicare simple.